because although the incidence is lower, they come at a very advanced stage. So if you create more awareness, incidence of colorectal cancer is rising, and more so in young Asian males having rectal cancer, and that's becoming a big problem, and we're seeing that trend all across Asia, and we need to be, creating awareness among our young that, not to ignore these symptoms. The important thing is if you pick up these colon rectal cancers early, we can cure the patients. So colorectal cancer is the fourth most common cancer in women worldwide, third most common cancer in men worldwide. Current incidence is low in India, but they come in an advanced stage. That's the problem. What are the reasons? Aging population, urbanized lifestyle, low physical activity, smoking, alcohol, poor diet, all these things are causative agents. So the incidence itself is 4 per 100,000 compared to the US or the UK where it's 35 per 100,000. But the problem again, as I said, is that patients seek help late because they ignore their symptoms initially. That's where I need help from everybody, from colleagues, friends, members of the press, to create this awareness so that people understand that if you have symptoms, and it's not settling, ask for help. As I said, it's the incidence of colorectal cancer rising, particularly in young Asian males with rectal cancer. So, we need to spread this information around. So how are we helping as a group, as a hospital group, as my colleagues from around the world? We try to create awareness through programs like this. We have an annual symposium which is happening this weekend. We spread the word. We use social media extensively for our patients to reach out, for our colleagues to reach out. So month of March is celebrated as Colorectal Cancer Awareness Month all around the world, and we try to do programs related to this so that we talk about it. So usually there's a stigma speaking about bottoms and your morning habits, but I think it's important to sort of create that awareness. If something is not right, you need to get it checked. So again, prevention is important. The public need to have a very healthy lifestyle, exercise regularly, eat a lot of fruit and vegetable, and cut down on red meat, and cut down on alcohol, avoid smoking. But the most important symptoms to look out for is blood in the stool, so blood in the motion, change in bowel habits, diarrhea or constipation lasting longer than 6 weeks. If you feel a lump in the abdomen, and anemia or unexplained weight loss, these are the main symptoms. Now, if you look at blood in the stools, I think that's the most common symptom. And normally what happens is, patients will think it's hemorrhoids or piles, and they would take some self-medication or see a local doctor, and most of the time ignore it. But important, if things don't settle in 6 weeks' time, you need to go see a specialist or get it checked, and that's very important information to hand out. So you can get screened. If there is a family history of colorectal cancer, or if you have these symptoms for more than 6 weeks, the most important thing is a good rectal examination. You can also have a fecal blood test, a colonoscopy or a CT scan. These are common tests used for screening. What are doctors doing to help? We are again, interacting with each other, forming collaborative groups so that we spread this message. We work in multidisciplinary teams within the hospital so that the best outcomes are achieved. It's not a one-man show anymore. We work with different specialties, medical gastroenterology, radiology, pathology, so that the best outcomes can be achieved for our patients. And we're also doing more subspecialized work. It's basically from general surgery we moved into gastroenterology, and now we're going into organ-specific disease treatments like colorectal disease or upper GI, hepatobiliary or pancreatic. And we use advanced techniques, laparoscopy, robotics, or newer techniques like transanal TME for rectal cancer in particular, where we avoid these permanent stromas, because that's a very important thing when you're treating rectal cancer problems. In our own institute, we are 3-4 years down the line now with subspecialized unit. We are well-trained surgeons. We are a very busy unit, and we offer services for all of colorectal problems, both cancer and non-cancer. More importantly, this year around, every year we launch new services as part of the institute. This year we're launching the Apollo Incontinence and Pelvic Floor Center. This is very important for women of this city because, after childbirth, 40% of women will have some symptoms of incontinence or pelvic floor dysfunction. And these people need to be checked because when you have normal childbirth, you will have some damage to the pelvic floor, and whether it's irreversible or reversible or is it causing symptoms need to be checked. So that needs to be assessed in a specialist unit. The problem is women might think it is a normal thing to have, but I think it has to be assessed to see if there is any long-lasting damage and how we can help it. Sometimes just physiotherapy will help it. and sometimes you may need a little bit of surgery. But again, most of it is just counseling and physiotherapy, but it needs to be managed by a specialist group of people, like urogynecologists, medical gastroenterological surgeons. We are having a dedicated hotline number for women to, if they are embarrassed, they can speak to this nurse on this particular number, and they have a physician assistant and a female urogynecologist who will assess them. And then if we guys need to have a look surgeons, then we will be called in. But it's a very important and it's a very specialist service, and we want to launch this for this year at the Institute. So we're also collaborating with the best centers in the world. We have colleagues from Cleveland Clinic, University College London, St. Mark's Hospital London, Advent, and of course Live Hospital from Turkey. So this creates awareness, it improves outcomes, patient outcomes, research, teaching, surgical training, accreditation, so that we do all this so that the best outcomes can be achieved for our patients. So we also hold our annual colorectal symposium and this is our third year, and we're very proud of it because it's one of its kind. We get the best physicians and surgeons who deal with colorectal disease from around the world to come and talk to us. And this year we've had more than 500 registrations, which is phenomenal, because it's only a third year of this program. And we have some of the best physicians in the world coming and talking to our junior doctors and trainees and even senior consultants. So this year the focus is going to be on colorectal cancer because lot is changing and evolving, new techniques, technology, robotics, transanal TME, laparoscopy, CME, and how you manage it, how you manage the complications, because that's what needs to be done. Surgery can be done, but it needs to be done safely so that the functional and clinical outcomes are at its best. So this is the third year, and I said, and we're also going to webcast this so that we can reach a worldwide audience through our Apollo MedVarsity channel. So at the end of it, we have on the Sunday evening, we have an annual dinner. The highlight of the dinner will be the Professor N. Rangabhasham Memorial. Professor Rangabhasham is very close to us. He's one of leading surgeons, and he was one of the guys who, a physician surgeon who introduced specialist colorectal services to this part of the world. And Professor Rangabhasham's third memorial oration is going to be given by Professor Mariana Burrow from Cleveland Clinic. She'll be talking on women in leadership because it's very important, and we see women leading in all aspects of business, trade, healthcare, and so this talk will be, will be very apt given by Professor Burrow and in the name of Professor Rangabhasham's memorial oration. Thank you. Now, can I invite Professor Stephen Wexner to come and say a few words, please?
International Colorectal Disease meeting here, and it is becoming international this year. I know we have large contingents coming from Bangladesh and Sri Lanka and elsewhere, Singapore, elsewhere in Asia, and I suspect over the years we're going to start attracting people from all over the world, over 500 registrants. Thanks to Singita and the rest of the family and the Apollo Hospitals group for the fantastic support. We couldn't do it otherwise, but it's more than just a meeting. It's a relationship, as you've heard, a relationship with a number of top hospitals around the world, and we thank the chairman and the rest of Ms. Reddy and everybody else for the support, because it's really important, the liaison we have with Cleveland Clinic, main campus, Florida, with the AIS channel in Spain that we've had for several years, and University College London, that there's a constant flow of ideas. It's not once a year, but it's having each other to the various institutions throughout the year, starting to exchange residents, collaborating together on research projects, on manuscripts, and working together to improve the care of patients throughout the world. So ideally, the evaluation and the treatment of a patient in Chennai is going to be no different than it is in London or Weston or Ohio or Barcelona or elsewhere, with the continued collaboration. That's a commitment that all of us have, and we're expanding the pool, as you've heard, with Orlando and St. Mark's in London and Istanbul. We're continuing to expand our global sphere of collaboration for the betterment of what's going on at Apollo Hospitals. One new thing since we've last been here, besides for speaking about rectal cancer and colon cancer, is the pelvic floor unit. And Dr. Munnikrishnan mentioned the importance of pelvic floor. That is also a global epidemic. It's a silent one. It's not a killer as colon cancer, but it is silent. People speak very freely about breast cancer. People speak about a lot of things. Colon cancer doesn't tend to be one of them, and fecal incontinence is even less. So as people have pelvic floor problems, which might be fecal incontinence, might be constipation, might be rectal pain, all kinds of different things that occur to the pelvic floor. Those are things that people may not realize can be fixed. A lot of people, for example, who don't have good control of their motions think that they're going to end up with a bag because nothing else can be done. And in this day and age, that's not true. But in order to arrive upon a treatment which is optimal, so the minimal amount of disfigurement, minimal risk of complications, and the maximal risk of improving quality of life, it's imperative that those patients be evaluated and managed at a tertiary referral center with a multidisciplinary team, as now exists at Apollo, launched this year, where it's a combination of gastroenterologist, the physician, the colorectal surgeon, as well as the other elements, neurology and imaging with biofeedback therapy, to then be able to implement the appropriate services as well as mental health support when necessary. So the idea of the multidisciplinary team going through not just cancer but also pelvic floor and morphing into other areas, I'm sure the same will occur here as more inflammatory bowel disease is now being seen. Another area where Apollo will lead the way in multidisciplinary efforts. So what's being done here every March is just a little tiny biopsy, what you will, of what goes on 365 days a year. Between Dr. Munnikrishnan and all of us who are always available to work with him, to help him, and to, again, try and ensure that best practices are available here. But again, it's clear to me, having just visited the phenomenal new Proton Center today, that no matter how bright he is and how energetic he is and how advanced and innovative his ideas are, none of it could come to fruition, and the patients, the population, the citizens of India could not get the kind of care available elsewhere if it weren't for the commitment of the Apollo Hospitals group, because it takes resources and it takes believing in that shared mission more than just having it. So I congratulate you again, Venki. Thanks for having me. And again, thanks to the Apollo Hospitals group for making Venki's dream and ours into a reality.
Request Professor Conor Delaney to say a few words. Thanks. Prof. Conor Delaney is Chair of Surgery at the Cleveland Clinic, Ohio.
As chair of the Digestive Disease and Surgery Institute for the clinic, and Dr. Steele, one of my colleagues in Cleveland, and our colleagues from St. Mark's in London and from Istanbul and from Orlando. It's really a pleasure to be here. So got to as well congratulate Dr. Munnikrishnan on his vision and thank Preetha Ritti Reddy and the Reddy family for their vision in supporting a congress like this. At the end of the day, I think what Dr. Munnikrishnan highlighted most importantly at the start of his talk is that this is about the patient, and this is about improving how you in India can care for patients. So we are also in the US in the middle of Colorectal Cancer Awareness Month, and I can think of a patient I just saw in my clinic earlier this week who was 45 and he'd had bleeding going on for a year, and it was presumed to be hemorrhoids or piles, and in fact he had an advanced rectal cancer and needed many surgeries and chemotherapy, and sadly for him, he's probably not going to survive this. So the awareness that Venki was talking about is really critical if we're going to improve how patients do. So one of our joys in being at a conference like this is the ability to collaborate and communicate with specialists from around the world. So we as a group are growing like you. We've hospitals in Ohio and the US, and we're expanding through Abu Dhabi and London and other places. And it's through doing international collaborations like this and then collaborating with other centers around the world, like you have here in the Apollo group, that we can really improve the standard of care that we bring to patients. So we had the privilege this morning of seeing the new hospital with the Proton Center, and it's absolutely outstanding. This is an absolutely first-rate center that's allowing the Apollo group bring really high standards of care to the local, national and even international community here. And then finally, I think what you're seeing is this coalescence of resources and people and skill sets that's been brought in by the Reddy family and the Apollo group, typified by what Venki has done with colorectal surgery. Because if you're going to manage these complex conditions, you need different types of specialists, from medical gastroenterologists to colorectal surgeons. And having the specialty trained surgeons is really important. Somebody who doesn't have the particular experience of a colorectal surgeon for colorectal cancer, for example, just won't have the right perspective managing the most complex conditions, whether it's cancer or whether it's pelvic floor. And I think you should all be very proud here of the group that's been put together by Apollo and by the team here. So again, thank you for the privilege of being here, and congratulations on all that has been accomplished.
Now can I request Vice Chairperson Ms. Preeta Reddy to say a few words. Thank you.
Our visiting faculty, I mean, we've got truly a galaxy. Thank you all for being here, Dr. Matthew Albert, Dr. Professor Janindra, and a doctor from Istanbul, which is so nice, Professor Hakan. It's amazing that, in the third year of inception of this conference, we've actually got people from truly the best in class. Cleveland Clinic as a brand is aspirational in the way it functions, and every aspect of clinical care is rated as one of the best. And for us to be able to have all of you visit us, in a way it kind of certifies the work which is done here. So I'd really like to thank you all, gentlemen, for being here with us. And more than anything else, it helps us reinvent ourselves. If it's really not a run for numbers, because in India we're treating, we are committed to treating 1.3 billion people, and at least 20% of them can actually come to any private sector hospital and get the kind of care which they'd like to. But I think for us to be able to really raise the bar on what we do year on year, raise the awareness, I think that's the commitment of the institution. We consistently have done it with our cardiac program, and ours is, one of the largest and most respected cardiac programs globally. And I'm saying this because, when you say Cleveland Clinic, it's usually cardiac. But then we realized that a few years ago, and that was thanks to Venki, that the department of colorectal, GI, pelvic floor, all that is completely state of the art. It's one of the best globally, and he came and told us that we should be working together to see that this is available in our country. And I think that was the beginning of the program. And 3 years down the road, I can say that people truly believe in the kind of work, in the kind of outcomes which is happening within our institution. And what typically happens is that if we can really raise the standard or the benchmark within our system and what we do, that others then start doing the same thing. They start copying. So the level of healthcare and the outcomes really go up in the country. The standards go up. And I think that's the responsibility of leadership in an institution like ours. So we really keep trying. And, it is, Professor Wexner said that the treatment is no different whether it's here or whether it's in the Cleveland Clinic. And I think that's really what we'd like to aspire for in every aspect of what we do. And a multidisciplinary team, I think, is a commitment which Apollo has made for the patients, because patients are entitled to high level and high standards of care. And if we can do that within our system, then I think it's a job well done. And systematically, in most departments, especially when it comes to oncology, it's happening. And I think people are entitled to it. And that's extremely important. the awareness is a big issue, and a lot of, especially Indians, unfortunately, do not really focus on prevention, do not focus on early detection. And we have been constantly pushing this of late because, our chairman is very committed to it. And when you catch signs of disease early, you can treat them well. If you can prevent the onset of something horrific happening, it's one of the best things which can ever happen. So, when we spoke about either screening or early detection, I think that's a commitment which Apollo has done. We run one of the largest screening programs, definitely in the country, but maybe even globally, because on any given day, over 2,000 people are screened within the Apollo system. And I mean like in-depth systematic screening. It's not like we run a few blood tests and say we've done screening, but it's a proper and a concentrated in-depth screening. So the colorectal screening now has become a big part of what we do. And the treatment after that, I think, is there's been a very concentrated focus on state-of-the-art treatment. So, whether it's investment into robotics, if it's investment into the best in class in terms of radiation or surgical support and care, I think Apollo's been investing in it and will continue to invest. And frankly, what are our options? We really have to do what we do, and we have to do them really well, with a strong commitment to be able to consistently focus on great clinical outcomes. You cannot have great clinical outcomes unless you have great clinicians. And I think the biggest strength we have within our system is, clinicians like Venki and a whole bunch of them. But more than anything else, the fact that, people like all of you come and support the program. There's exchange of thoughts, exchange of wisdoms, exchange of techniques and ideas, and also a look into the future on how healthcare can pan out. And as I'm very fond of saying, people like me are only the support system, because I'm not a doctor, but we've learned from our chairman to be completely uncompromising when it comes to the delivery of healthcare. So I really welcome all of you. I'd like to thank the organizing team for putting this together. It's very hard to do something year in and year out. You can do it once and do it beautifully. It's a bash and then you forget all about it. But to consistently run a program every year takes a lot of commitment. And I can see that happening, and I can see the program growing, whether it's the learning from people who sign in for it, or whether it's the learning from in-house and the public awareness. And I think here I'd like to really thank the members of the press and both the print and the visual media, because unless you all support the vision and the dream, I don't think Apollo can continue to do what it does. And this has been going on for the past 35 years from the time we started, and we have come a long way. And one of Chairman's most favorite lines, which you'll all hear a bit later, is that we have to find ways and means to keep people out of hospitals. And to do that, you have to actually work much harder, because we can treat everyone who comes into the Apollo system. We're committed to doing the best in class. Everybody knows it. But to prevent the onset of disease is the biggest issue now, and that's what we're all committed to doing. So this awareness programs like this go a long way, and I'm glad we're starting this this whole division of the pelvic floor issues. A lot of women in India won't even think or talk about it, and it goes for the men too, and to be able to really give them the concentrated effort and care on that aspect of the problems people have, I think is a big thing, and not many people have really focused on it as a department. So I'm so glad that Apollo and its team of doctors are doing that, and I do wish that program a huge success, and I'm sure it will continue to heal people the way it has to do. So thank you all again, gentlemen, for taking the time off to be here with us. And as always, it's a pleasure to be part of anything wonderful and new which Apollo is committed to doing. Thank you.
I will take them. If not, I can, come and individually talk to you all. Thank you.
நான் டாக்டர் வெங்கடேஷ் மணிகிருஷ்ணன். நம்ம கோலோரெக்டல் சர்ஜன் அப்போலோ மெயின் ஹாஸ்பிட்டலில் இந்த மாதம் மார்ச் மாதம் வந்து பெருங்குடல் மற்றும் மலக்குடல் புற்றுநோய்க்கான அவேர்னஸ் மந்த். இந்த பிரச்சனை வந்து உலகம் முழுவதும் பெரிய பிரச்சனை ஆகிட்டுருக்கு. சிறியவர்களிலிருந்து முதியவர் வரைக்கும் எல்லாரையும் பாதிக்குது. இதில் முக்கியமான என்ன சிம்டம்ஸ்ன்னு பார்த்தீங்கன்னாக்கா, மலத்தில் ரத்தம் சேர்ந்து போவது, மலம் கழிப்பதில் பிரச்சனை, அனீமியா ரத்த சோகை, இல்லாது வயிற்று வலி, இல்லை வயிற்றில் ஒரு கற்றி, இதெல்லாம் இருக்கலாம். இருந்ததுனாக்கா ஒரு 4-6 வாரத்தில் இது சரியாகலைன்னா நீங்கள் ஒரு மருத்துவரை அணுகி அதை செக் பண்ணிக்கணும். ஏன்னா என்ன பெரிய பிரச்சனைன்னு பார்த்தீங்கன்னா, மக்கள் வந்து இதை வந்து உதாசீனப்படுத்திடுவாங்க. இது வந்து மூலமாக இருக்கலாம், இல்லை பைல்ஸாக இருக்கலாம், அப்படியே விட்டுருவாங்க. இல்லாட்டி எதாவது மருந்து வாங்கி சாப்பிட்ருவாங்க. ஒவ்வொரு வாரமும் நாங்கள் யாராவது ஒரு பேஷண்ட் வந்து இது மாதிரி அவங்களே செல்ஃப் ட்ரீட் பண்ணி இது சரியாக கவனிக்காமல் அட்வான்ஸ் ஸ்டேஜில் வராங்க. அட்வான்ஸ் ஸ்டேஜில் வந்தால் ட்ரீட் பண்ணுறது ரொம்ப கஷ்டம். ஏர்லி ஸ்டேஜில் வந்தால் புற்றுநோயை முற்றிலும் அகற்றி குணப்படுத்திடலாம். இந்த புற்றுநோயை ட்ரீட் பல வழிகள் உண்டு. ஓப்பன் சர்ஜரி இருக்குது, லேப்ராஸ்கோப்பி இருக்குது. இப்போ மோர் ரீசெண்டாக ரொபாட்டிக் சர்ஜரி வந்திருக்கு. இது மிக துல்லியமான சர்ஜரி, பிளட் லாஸ் கம்மி, காம்ப்ளிகேஷன்ஸ் அல்ல. ஸோ அதுதான் நெக்ஸ்ட் ஸ்டேஜில் இருக்கும். அது இல்லாமல் we are starting a new service, Apollo Main Hospital. அது பேர் வந்து pelvic floor center and center for incontinence. இது எதுக்குன்னாக்கா பர்டிகுலராக வந்து மகளிரை பாதிக்கும். அவங்க என்ன சிம்டம்ஸ் சொல்லுவாங்கனாக்கா, தும்முனாக்கா, இருமுனாக்கா யூரின் லீக் ஆகுது, இல்லை ஸ்டூல் லீக் ஆகுது, மோஷன் லீக் ஆகுதுன்னுவாங்க. இது மோஸ்ட் காமனாக ஏன் வருதுனாக்கா, ப்ரெக்னென்சி டெலிவரி ஆன பிறகு இந்த ஆசனத்தை சுற்றி இருக்க தசைகள் பாதிக்கப்பட்டு அந்த வீக்னஸ் வந்து அதனால் அது வரலாம். ஸோ மெஜாரிட்டி நிறைய பேர் அதை வந்து அதுக்கு என்ன ட்ரீட்மெண்ட் தெரியாமல் அதை அப்படியே உதாசீனப்படுத்துகிறோம், இல்லாட்டி வெளியில் சொல்ல முடியாமல் இருப்பாங்க. அதுக்குன்னு ஒரு ஸ்பெஷல் சென்டர் ஒன்று ஆரம்பிக்கிறோம். அதில் வந்து அந்த ஒரு நம்பரும் கொடுத்துருக்கோம். அந்த நம்பரை கான்டாக்ட் பண்ணாக்கா ஒரு நர்ஸ் கிட்ட பேசி, ஒரு ஃபீமேல் டாக்டர் கிட்ட பேசி அதை அசஸ் பண்ணி அதுக்கு ஃபிசியோதெரப்பி இல்லை வேறு எதாவது என்ன சிகிச்சை இருக்குன்னு அதுக்கு அறிவுரை பெற்றுக்கொள்ளலாம். இது ஸோ கேன்சர் வந்து பார்த்தீங்கன்னாக்கா இட் டிபெண்ட்ஸ். இப்போ நல்லா இன்சூரன்ஸ்லாம் உள்ளே வந்திருக்கு, அதனால் இன்சூரன்ஸ் கவர்ஸ் தட். கவர்மெண்ட் ஹாஸ்பிட்டல் ட்ரீட் பண்ணுறோம், ப்ரைவேட் ஹாஸ்பிட்டல் ட்ரீட் பண்ணுறோம். ஸோ ஓப்பன் சர்ஜரி தான் இருக்கிறதே ரொம்ப சீப். மினிமல் லேப்ராஸ்கோப்பி மற்றும் ரொபாட்டிக்ஸ் கொஞ்சம் எக்ஸ்பென்சிவ். பட் என்னென்னா, நீங்கள் ஏற்கனவே சொன்ன மாதிரி ஸ்பெஷலிஸ்ட்டாக கோலோரெக்டலோ இல்லை ஒரு ஆர்கன் ஸ்பெசிஃபிக்காக பண்ணோம்னா அது எக்ஸ்பர்டீஸ் ஜாஸ்தி இருந்தால் விரைவாக செய்யலாம். அதனால் காம்ப்ளிகேஷன்ஸ் கம்மியாக இருக்கும், காஸ்ட் கம்மியாகும். ஒரு 2-3 லட்சம் வரைக்கும் ஆகலாம் இந்த அட்வான்ஸ்ட் டெக்னிக்ஸ்லாம் யூஸ் பண்ணுறதுக்கு. So every year in the institute we see 1,000 treats operate on 1,200 colorectal operations. Cancer nu pathina 250 to 300 cancer operations பண்றோம். இந்த குறிப்பா இந்த சிறுகுடல் பெருங்குடல் இந்த பெருங்குடல் மற்றும் மலக்குடல் புற்றுநோய் வந்து when compared to மற்ற இடத்தை விட தமிழ்நாட்டில் அதிகமா இருக்கா? கரண்ட் சினாரியோல கரண்ட் சில இயர்ஸ்ல எந்த அளவுக்கு அதிகமாயிருக்கு? ரொம்ப அதிகமான வந்து இந்த இது வந்து நார்த் இந்தியாவில் தான். பிகாஸ் ஆஃப் நிறைய மீட் சாப்பிடுவாங்க. நம்ம இதில் வந்து ஜென்ரலாக வந்து நம்ம வந்து நிறைய வெஜிடபிள்ஸ் சாப்பிட்றோம், வீட்டில் சமைச்சு சாப்பிட்றோம். பட் என்ன பிரச்சனைப்பா, நிறைய இப்போ ஃபாஸ்ட் ஃபுட் சாப்பிட ஆரம்பிச்சிட்டோம். ஒபிசிட்டி ஜாஸ்தியாச்சு, உடல் பருமன் ஜாஸ்தியாக இருக்குது. நிறைய ஸ்மோக்கிங், யங்ஸ்டர்ஸ் எல்லாம் பண்ணுறாங்கன்னு சொல்ல வரல. பட் ஸ்மோக்கிங் எல்லாம் வந்து கல்ச்சுரலி இதெல்லாம் அக்செப்டபிள் ஆயிடுச்சு. நிறைய ஆல்கஹால் சாப்பிட்றது இதெல்லாம் உடம்புக்கு நல்லதில்லை. ஸோ யூ ஹேவ் டு கட் டவுன் ஆன் தட். ஜென்ரலாக வந்து நிறைய தண்ணி குடிக்கணும், எக்ஸசைஸ் பண்ணணும், உடற்பயிற்சி ரொம்ப முக்கியம், ஹெல்த்தியாக சாப்பிடணும், ஸ்மோக்கிங் ஸ்டாப் பண்ணணும், ஆல்கஹால்லாம் கம்மி பண்ணணும், ரெட் மீட் யூனோ அதை அவாய்ட் பண்ணுறது ஃபிஷ் சிக்கன் அதெல்லாம் பரவாயில்ல, ரெட் மீட் அவாய்ட் பண்ணுறது பெட்டர். ரொம்ப முக்கியமான விஷயம். Generally not. Fish is actually one of the healthiest food. Fish நான் சொல்ல red meat. Most common cancers பார்த்தீங்கன்னா lung cancer, breast cancer, colon cancer is increasing.
Sorry, for 2 lakhs 3 lakhs னு சொல்றீங்க சார். சோ அந்த அளவுக்கு அமௌண்ட் கொடுத்து அத ட்ரீட்மென்ட் எடுத்துக்க முடியாதவங்க.
So இதுதான் so அடைய so காஸ்ட்னு பார்த்தீங்கன்னா இப்போ ஜென்ரல் வார்டில் இன்னும் கம்மியாக பண்ணலாம். பேஷண்ட்ஸ் வந்து ஒன்று நம்ம கவர்மெண்ட் ஹாஸ்பிட்டல் போகலாம், இல்லை இந்த காப்பீட்டு திட்டம் யூஸ் பண்ணலாம், இல்லைனாக்கா ஜென்ரல் வார்டில் காஸ்ட் கம்மியாக இருக்கும், ப்ரைவேட் ஹாஸ்பிட்டல் ட்ரீட் பண்ணலாம். ஸோ தேர் ஆர் மல்டிபிள் வேஸ் டு டூ இட். அதனால தே வில் ஃபைண்ட் ட்ரீட்மெண்ட் எங்கேயாவது ஒரு இடத்துல. என் பேர் டாக்டர் வெங்கடேஷ் முனிகிருஷ்ணன், பெருங்குடல் மற்றும் மலக்குடல் சிகிச்சை நிபுணர்.
ஓகே, நன்றி.
தேங்க்யூ.